The following interviews are the opinions of real individuals. They reflect their views and are in no way fabricated.
My name is Yolanda Mordew. I am with the County of Ventura and my title is Insurance Services Administrator. However, my job objective is to bring revenue to the Ventura County Healthcare Agency to support the hospital and clinics within the county, who together act as the safety net for those in our community who are underserved by the local medical community.
Hi, I'm an anonymous Ventura High School student, and I'm speaking for myself and many other teenagers at Ventura High School.
Hi, I'm Beatrice Pearl, but you could call me Grandma Pearl. I'm 72 years old and feeling strong. I was born in North Carolina, Virginia, and I got 3 cats, and I like to knit. I like to knit sweaters for my cats. I got Mitten, Smitten, and Kitten. I love my Kit Kats.
Well, I struggle with the current system due to the obvious difference of the haves and have-nots. I see everyday people who, because they fear they cannot afford it, do not access healthcare for preventative services. There are people with diabetes who do not seek treatment, and because of that, they lose their toes and or feet. Unfortunately, this is the same population who use the ER as their family doctor, and therefore a simple visit to the doctor, which would cost under $100, is now an expensive ER visit for $1,000, and they will struggle to pay that. Because of the difficulty in accessing appropriate routine medical care, they have a perverse incentive to access the ER.
Well, I guess I'm pretty indifferent with it because my parents pay for it, so I don't really know. I guess it's concerning.
Well, I think that the system in the USA fails to many people because the cost of insurance and healthcare is out of reach for many. Most of them don't even get treatment for the health problems.
This is another struggle. I have worked in the insurance industry, which I have enjoyed and seen the benefits, but I've also seen the greed and shuddered at the profits. I understand the ethics of healthcare, but I also understand that physicians and hospitals are businesses and need to cover their costs, which increase with technology. I think I would make it mandatory for insurance companies to create affordable options for small employers and families. I also think they should be subsidized for this scope of business.
This one's a given. I'd make it affordable for everyone else in the U.S. Duh.
I think affordable health insurance should be accessible for all U.S. citizens provided by insurance companies, not the government.
I have the benefit of being in the industry and knowing how to work with physicians and insurances, so it is easy for me and my family. My current insurance plan is quite good, but only because I have this through my husband's employer. His employer is a national company with thousands of employees and therefore has purchasing power with insurance companies to offer the best. As an employee of the County of Ventura, I have the option of multiple insurance options, but at a cost for myself and my husband. The cost is not exorbitant, but my husband's employer covers him at no charge and minimally for me, his spouse. We also both have a flexible spending account via our employers to help defray our out-of-pocket expenses.
My coverage is good, I guess. I mean, I go to the doctor, I pay a small fee, so it's alright.
I myself have excellent health insurance since it is provided by the federal government. The government is the largest employer in the U.S., you know, so it can obtain the best at the lowest cost. Also, the politicians make sure their insurance is the best, so I also benefit.
I have difficulty with this. Like me, there are many people who work in the healthcare industry, and as soon as I say it is a right, that changes the business. Do we become so regulated that you can control the cost of services? Can you tell a physician how much he can charge for a routine office visit? Then because we can control his income, can we then mandate the medical building to charge him a specific amount per rent? because the services he is rendering is a right, I do not see the end of this argument, but to be honest, I am not sure I see another option.
Right, I guess?
What was the question again, dear?
Medicare is the government healthcare program. I do not think that it is working. It is running out of money. Most say due to fraud, but is that because it is a government program or because of federal funding? I do not think the government can run it efficiently. It has yet to prove that it can run Medicare, so why add to it? I think private insurance companies are much more efficient at managing this business due to their understanding of the day-to-day operations, including limitations, utilization, and review of appropriate medical services. The other side of this is how do you make people and employers purchase insurance? Those who are healthy will not think they need it, but their premiums and payments will be needed to help support the services. There's been a lot of talk about these big plans at a larger picture perspective, but no real detail to see how they would handle many of the smaller issues.
Yeah, I support Obama's new public plan. I mean, for one, he's black. That's sick. And because it's going to be more affordable for the U.S. citizens, but it's because it's Obama. Duh.
I support some of his options. Government should not be in the business of providing insurance, but should ensure that people have affordable access to it, and should put regulations in place to control cost and spending. No tax increases should be placed on the citizens to provide health care.
I think Obama would garner great praise if this passes, as many have tried. My concern is how it is done. How do you pay for it? Because so far, nothing I have heard makes sense. The statement of everyone deserves health care sounds great, but until I see the details on how to do it and who will manage it, I have to say I'm still very skeptical.
What does that mean? I don't know.
You know, healthcare has been a political issue since World War II. Any president that is able to pass legislation to improve or advance the issue will gain a great political legacy if it is a good program. Since we have two-party systems, any political fortune Obama achieves will be criticized by the opposite party. Unfortunately, any change in the current system have a huge economical impact on the insurances and the people.